Can a visual acuity test detect optic nerve issues? Have you ever wondered if a simple eye test can reveal serious problems with your optic nerve? While visual acuity tests are a common part of eye examinations, they have limitations. A standard visual acuity test measures how clearly you can see fine details at a distance, usually using high contrast letters. However, it is generally not enough to detect optic nerve issues directly. Optic nerve damage can affect vision, but early or subtle problems might not show a noticeable decrease in the sharpness of your vision. Conditions like glaucoma and optic neuritis involve damage to the optic nerve, which can impair vision in ways that a standard test may not capture. For instance, low-contrast visual acuity testing can be more effective in detecting optic nerve involvement. This type of testing uses lower contrast targets, which can reveal visual loss that standard tests might miss. Another important tool is visual field testing. This test measures your entire scope of vision, not just how well you can see details in the center. Damage to the optic nerve often leads to specific visual field defects, such as loss of peripheral vision. This makes visual field tests critical for detecting optic nerve dysfunction, especially in conditions like glaucoma. Additionally, advanced imaging techniques such as Optical Coherence Tomography, or OCTOBR, can provide structural images of the optic nerve fibers. This method measures the thickness of the retinal nerve fiber layer, helping to detect and quantify any damage. Visual Evoked Potentials, or VEP, are functional tests that can also assess the health of the optic nerve more directly than visual acuity tests alone. In the context of eye diseases, glaucoma primarily affects the optic nerve and often leads to peripheral vision loss before any decline in central visual acuity. This means that relying solely on visual acuity tests can overlook early signs of glaucoma. On the other hand, macular degeneration affects the central retina, which can lead to a reduction in central visual acuity. In this case, visual acuity tests are more relevant for detecting macular disease than for optic nerve issues. In summary, while a standard visual acuity test is an essential part of an eye exam, it cannot reliably detect optic nerve issues on its own. More specialized tests, including low-contrast visual acuity, visual field testing, OCTOBR imaging, and electrophysiological assessments, are necessary to comprehensively evaluate optic nerve health. These tests work together to provide a more accurate diagnosis and monitoring of optic nerve diseases, including glaucoma and optic neuritis. If you have concerns about your vision or eye health, it is always best to consult with a healthcare professional for personalized advice.